Not only ang obvious change will be nidako yung abdomen mo kay na ay fetus na sa iyang uterus, but there are still other many changes that occurs in a patient's, in a woman's body internally and externally. Okay, so we have here the physiologic adaptation to changes in pregnancy. This is found in page 213 to 220 and 265 to 270 of your book, The Maternal and Child Nursing by Pelletier. So even page kabalo ko, no? Because I read. That's why you read also. So 213 to 220 ni and 265 to 270 of your book siya makita. So what are the systemic changes? First, we have the cardiovascular system. There is increased blood volume among pregnant women by 30 to 50%. That is, before pregnancy, if a woman's blood volume is 4,000 ml, in pregnancy, it may become 5,200 ml or more. Okay. And then there will be blood loss. This increase in blood volume in pregnancy is in preparation for blood loss from normal vaginal birth, because there would be around 300 to 400 ml of blood loss during normal vaginal birth. And during CS, the blood loss may be 800 to 1,000 ml. So mawala ra gyapon tong increase in blood volume niya during delivery. There will also be increase in plasma volume. No? So if before pregnancy, if a woman's plasma volume is 2,600 ml, during pregnancy, it will reach as much as 3,600 ml ang iyang plasma volume. There will also be increased cardiac workload. No, mas dakog trabaho ang iyang kasing-kasing. That will result in easy fatigability and slight and slight ventricular hypertrophy. Magka-epistaxis po ang pregnant woman. Epistaxis is nose bleeding. So mag-epistaxis po due to hyperemia of nasal membrane. And there will also be palpitation because of SNS stimulation. Okay? So your nervous system also play a role. That's why there will be palpitation. And then the BP usually is decreased in the second trimester. And then pag-abot sa third trimester, the BP goes to the level na pre-pregnant pa siya. So kung yung BP itong pre-pregnancy, that is the same BP as in the third trimester. Okay. And then we have what we call as physiologic anemia or pseudo-anemia in pregnancy. Magka-anemia, murag nag-anemia ang pregnant woman. Napili anemia, but nimupo lang ang yan, hemoglobin lang, no? Okay, the reason for this physiologic anemia or pseudo-anemia in pregnancy is because the blood volume expands during pregnancy, which is slightly ahead of the RBC count. Okay? Pero kung ano na siya, expected na siya during pregnancy, normal. Dili siya mumubo, less than normal. Mumubo lang compared sa iyang usual na RBC count or hemoglobin count. Okay? Ang pathologic anemia, kanang dili physiologic anemia, pathologic anemia, katong tinuod yun na anemia nga, mumubo yun ang iyang hemoglobin count less than normal, that is probably because of iron deficiency anemia. Okay? So iron deficiency anemia is the most common hematologic disorder in pregnancy. It affects around 20% of pregnant women. So, sa maiyahang signs and symptoms, sa iyang assessment value, you have pallor, so luspad ang pasyente. Slowed capillary refill. What is a normal capillary? Do you know how to get the capillary refill? Katubitang mo check ang blanching sign sa finger sa patient. Imong iipit ang finger sa patient sa imong, imong i-press din, not iipit. I-press nimo ang finger sa imong patient with your fingers. And then, after how many seconds, imong i-release. Muluspad pa ito pilmiro, no? Pero dapat mapula siya balik in 2 to 3 seconds. That is the normal capillary refill, 2 to 3 seconds. But in pregnant women who have iron deficiency anemia, there will be slowed capillary refill. More than 3 seconds ang pagbalik sa pagpula atong iyang finger. So, basta po problema din niya ang oxygenation. No? And then we have clubbing. Clubbing is concavity of the fingernails, which is a late sign of progressive anemia and chronic tissue hypoxia. So, ang clubbing, muraming lapad na iyahang end sa iyang fingers o toes, no? Muraming mo kutsara ang forma. That is a response of our body towards poor oxygenation or poor blood supply. Mo expand ang atong capillaries kay poor ang blood supply. So, mga na mag-clubbing or concave fingernails. And then there will also be constipation. So for our nursing care in patients with iron deficiency anemia, we have to provide nutritional instruction. No? So we have to advise patients to increase intake of foods which are rich in iron, like green leafy vegetables, organ meats. Here, this is where nutrition and diet therapy would come in. Importante yung nutrition and diet therapy kay isa siya sa mga treatment sa mga different disorders or diseases sa mga patient. Ang poor nutrition could makalid sa mga disorders or diseases. So nutritional instruction on the sources of iron like kangkong, liver, and then red and lean meat, green leafy vegetables, and then pwede po parenteral iron per doctor's order. No? So, parenteral iron per doctor's order. Pag maghatag kag iron na intramuscular, dapat Z-trap technique ang imuhang gamiton na technology. And then oral iron supplements. Nganong Z-trap atong gamiton sa kuan sa injection of IM iron or intramuscular iron para dili mag-hematoma ang pasyente. Okay, for oral iron supplements naman, meaning kanang mga tabletas, iron supplements, through the mouth siya indon, so oral, no? So, that is best given 1 hour before meals para ma-ensure yung absorption sa iron. So, give it 1 hour before meals. It may cause GI irritation ang iron or ang oral iron preparation. Okay? But it needs to be absorbed. If wala ni mamahatag 1 hour before meals, pwede na siya i-give 2 hours after meals. Okay? However, tungod kay pa siguro ma-digest ang upa ni mong foods na kinaon, masig poor ang digestion sa iron. Pero at least 2 hours after meals, hindi na kay poor. Then you take it with food. Do not take it with food. Ha? To take it it is best given 1 hour before meals, pero kung nalimtan, it may be given 2 hours after meals. Kaya lang, mas poorer ang absorption from 2 hours after meals. And it is also given with orange juice or any citrus juices to increase its absorption. So usually, ang inahatag is oral iron supplements na ferrous sulfate, 30 milligrams per day. And then monitor for hemorrhage. Bleeding may occur, or bleeding itself may cause anemia. Okay, so another systemic changes during pregnancy would be in the cardiovascular system. Okay, one thing that may occur is the edema, or ang pangpupong, or ang fluid shifting from the intravascular compartment to the interstitial compartment. So, hupong ng edema. It is because of the impeded venous return to the gravid uterus. So, usually, sa tiil na siya manghupong in the afternoon. So, our nursing intervention here is to elevate the legs above the level of the hip. And then another problem is varicosities, varicose. So wear support stockings and elevate legs, no? Para ma-relieve or para ma-prevent ang varicosities. And then we have vulvar varicosities. So dili lang sa tiil mahitabo ang varicosities, no? Pati sa vulva, pwede na siya mahitabo. So, para sa vulvar varicosities, nga nung mag-varicose to siya sa vulva niya, that is because of the pressure of the gravitatorus sa bugat niya nga tiyan. So, pwede siya mag-develop of vulvar varicosities. So, to prevent this or to relieve this, so place patient in a side-lying position with a pillow under hips or sometimes a modified knee chest position. And then another is thrombophlebitis. This is not a normal occurrence, ha? But it could occur, ang thrombophlebitis. Hindi na siya normal occurrence. Kung ano na siya, pathology na ni, sakit na ni. So thrombophlebitis could occur due to the presence of thrombus in inflamed blood vessels. So ang imong sign ani nga na thrombophlebitis would be the positive Homan sign. Kaning positive Homan sign, this is a pain in the calf upon dorsiflexion. So medical management nato kung na ay thrombophlebitis, anticoagulant nga heparin. Heparin is the choice or anticoagulant of choice because it does not cross the placental barrier. And if patient is taking heparin, monitor the activated partial thromboplastin time, and you have to prepare at the bedside the antidote, which is protamine sulfate. Ha? So, pag maghatag ang ikag anticoagulant, natin duha ka klase ka anticoagulant class, no? The warfarin, Coumadin, and the other one is heparin. Kung ang gihatag nimo warfarin, Coumadin, you are going to check for the prothrombin time. The normal prothrombin time is 10 to 12 seconds. Pero pag maghatag kag warfarin, pero pag mag-take a patient of warfarin, Coumadin, mutaas na yung prothrombin time by 1.5 to 2. So from 10 to 12 seconds, nahimo na siyang 15 to 20 seconds. Expected na siya. Kay nag-anticoagulant man siya na warfarin, Coumadin. Expected, pero since dili normal, higher than normal siya, the patient may bleed because of the treatment. Kaya kanina magod ka treatment, anticoagulant, i-prevent ka pag-form of thrombus. I-prevent ka pag-form of blood clots. Kaya na kay problema sa blood clotting. So as a result, pwede ka mo bleed tungkol sa treatment. So that's why you have to prepare the antidote at bedside. The antidote for warfarin, Coumadin is vitamin K. Now the other type of anticoagulant is the heparin. And this is the choice when a woman, this is the anticoagulant of choice when a pregnant woman develops clotting problems like thrombophlebitis. Because heparin does not cross the placental barrier. Hindi siya moabot sa bata, makadaot sa bata. Whereas the warfarin, it can cross the placental barrier. Now, pag heparin, ang imong ihatag, check for the partial thromboplastin time. So, kanina, prothrombin time, atong i-check mo sa warfarin. Sa heparin, ang atong i-check partial thromboplastin time or activated partial thromboplastin time. The normal is around 20 to 40 seconds. Pero mo elevate na siya by 1.5 to 2 when you are taking heparin. So, since mo elevate iyahang activated partial thromboplastin time, pasabot, dugay ka mo form of clot. So, pwede ka mo bleed. So, kung mo bleed gali ang patient because of the heparin treatment, you have to give the antidote. When i-prepare daan sa bedside ang antidote, and the antidote for heparin is protamine sulfate. Okay, and then when you are giving anticoagulants like heparin, do not give aspirin to the patient because aspirin is an antiplatelet. So when you give it together with an anticoagulant, you will cause massive bleeding of your patient. And then another problem that may occur in pregnant women is the milk leg or phlegmatia alba dolens. No, this is shiny white legs due to the stretching of skin and hyperfibrinogenemia related to deep vein thrombosis. This is due to the compression of the left common iliac vein against the pelvic rim by the enlarged uterus or due to malignancies or cancer. So our nursing interventions for this, check dorsalis pedis pulse and compare both, never massage, and assess for Homan sign only once. So again, kaning thrombophlebitis, milk leg or phlegmatia alvodolens. This is not a normal occurrence during pregnancy, but it may occur. It is a common occurrence among pregnancy, and it is difficult to treat. Okay, next, systemic changes. You have the respiratory system. So what will happen to the respiratory system of a pregnant mother? There is shortness of breath because of the gravid uterus. Shortness of breath because of the gravid uterus. So our nursing interventions is to have the patient be on a side-lying position, because the side-lying position will cause lateral expansion of the lungs and cause or somehow relieves shortness of breathing. So mag-shortness of breathing siya because of the gravid uterus, diba? Compress ang lungs. What you're going to do para mas facilitate ang easiness of breathing, have the patient assume a side-lying position o sakay. And as a gastrointestinal system, the pregnant mother may have nausea and vomiting. Okay, we call this often as morning sickness, no? Kanang magsigig suka-suka ang mama, morning sickness. Okay. Although morning sickness may occur any time of the day, but it is common manggod, or it usually occurs in the morning. That's why it's called as morning sickness. It's called as morning sickness kaya mo occur siya usually sa morning, but it can actually occur any time of the day. Okay? And then mawala rin na siya after the first trimester. First trimester na grabe ang morning sickness, no? So nga nung magka-morning sickness na nung na yun ng pregnant mother during the first trimester, that is because of the increase in the human chorionic gonadotropin levels. Di ba magkaroon mag-increase ang HCG levels sa pregnant mother? Kung na siya makakosa in morning sickness. So what we are going to do during morning sickness is to give the mother crackers 30 minutes before arising. Crackers. So carbohydrates 30 minutes before arising. And after that, give the mother small, frequent meals. Pakanon pirmi, pero hinagmay. Okay. Another problem that is common during pregnancy is constipation. So, duglalibang, dahilibang, tublon. Okay, this is because of the progesterone increase. Okay, kung daghan na go progesterone ta, it will facilitate fluid reabsorption and decrease GI motility. Kung naatay progesterone, increase ang fluid reabsorption, decrease ang GI motility. So, resulta, uga kaing tae. Also, another hormone which is found in pregnancy is relaxin. The relaxin will also contribute to a decrease in GI motility. So, mauna na mag-constipate yun ang pregnant. So, nga to ang nursing intervention, ano yung constipation, increase the fluid intake, increase the fiber intake, and have the mother perform exercise. Exercise, nga tolerable sa iya, sa matolerate na. And then another problem is flatulence. This is due to increased progesterone. So what you're going to do is avoid gas-forming foods. Para di siya mag-utot-utot. Another problem is heartburn or pyrosis, no? This is the reflux of stomach content into the esophagus. So our nursing intervention sa heartburn, give small frequent meals, give sips of milk, avoid fatty and spicy foods, and observe proper body mechanics. Meaning, dili magsigig kuan, higda ang upper body lower than the lower body, di magsig duko, di magsigig bend. Okay, because that can further increase the occurrence of heartburn. And then another problem is hemorrhoids because of the gravid uterus. So what you're going to do is to give hot sitz bath for the mother for comfort. And then thialism or increased salivation. To give mouthwashes to relieve thialism or salivation. And then we have the urinary system. So it is normal for a pregnant mother to have a positive blood sugar in the urine due to progesterone via Benedict's test. Okay. So, for the first trimester also, there is frequency in urination. Magsigig-ihi-ihi ang mama during the first trimester, no? Because of the pressure of the growing uterus on the anterior bladder. Sa second trimester, since ning rise na ang uterus above the bladder, so normal na ang iyahang urine output. Pero pag abot na po ang urinary frequency rather. Pero pag abot na po ang third trimester, na po urinary frequency, sige na po siya ihi-ihi, mga 10 to 12 times a day. That is because the fetal head now presses against the bladder. And ubos naman po ang fetus during the third trimester. So again ha, first trimester, urinary frequency. Second trimester, normal. Third trimester, urinary frequency. And then sa musculoskeletal system, the pregnant woman needs a lot of milk, no? Calcium rather. So, dapat pa ito siya milk, about 3 to 4 servings per day. And then the common musculoskeletal system changes during pregnancy. We have lordosis. This is the excessive inward curve of the spine. This is what we call as the pride of pregnancy. Kanang ito mo ibod ang lupot. That is lordosis. We call them as a pride of pregnancy. And then we have the waggling gait. This is an awkward gait while walking because of the hormone relaxin. Kato pong lordosis, that is because of the hormone na relaxin. And then the woman is prone to accidental falls. So let the woman wear low-heeled shoes. And then leg cramps may also occur because of calcium-potassium imbalance during pregnancy, and because lumbosacral nerves by pressure of gravid uterus during labor, or it could be due to being overset, so leg cramps will occur. So what you're going to do to prevent this is give 3 to 4 servings of milk, sardines, or dilis, or whatever is calcium, whatever foods that are rich in calcium. Okay, so those were the systemic changes. This time we have the local changes. What happens to the woman's vagina during pregnancy? So sa vagina, we have the Chadwick sign. The Chadwick sign is the bluish discoloration caused by the hormone estrogen, which results in venous congestion. It can be observed as early as 6 to 8 weeks after conception. The Chadwick sign has bluish discoloration of the vagina. Leukorrhea is a thick whitish or yellowish vaginal discharge, moderate in amount, mousy odor, that is because of estrogen imbalance. And then we have, for the cervix, there will be Goodell sign. Goodell sign is the softening of the cervix. And then there will be the appearance of the operculum. The operculum is a mucus plug in the cervix to seal bacteria. And then we have the Hegar sign in the uterus. The Hegar sign is the softening of the uterine consistency and the possibility to palpate or compress the connection between the cervix and the fundus. This usually occurs from the 4th to 6th week till the 12 weeks of pregnancy. Now, because of the environmental changes and the pH changes, in the vaginal environment, the pregnant woman may encounter problems like vaginitis, moniliasis, gonorrhea, and vaginal warts. So vaginitis, as you very well know from your microbiology, it's caused by Trichomonas vaginalis, which is a flagellated protozoan and loves the alkaline environment. Signs and symptoms: anemia, greenish, cream colored, frothy, irritably itchy, foul-smelling vaginal discharge. Murag avocado shake na discharge. No? And then there will be vaginal edema. Sa management, ang drug of choice, metronidazole flagyl, single-dose therapy with 2 doses orally. And this is an anti-protozoan, but it is not given in the first trimester because it is teratogenic in the first trimester. Okay. And then, dili man pwede mag-vaginal douche ang pregnant woman para mag-cleanse ang vulva. So, ang substitute na to ani is vaginal wash unsay tawag ani nga nahimo. That is 1 quart water and 1 tablespoon white vinegar. Ito na siya ang natural na vaginal wash, no? Ang ibang problema nato sa vaginitis with Trichomonas vaginalis, it loves a basic or an alkalotic environment, alkaline. So ipa acidic na to. O na nga to ang vaginal wash, vinegar. Dili pure vinegar ha. 1 quart of water mixed with 1 tablespoon white vinegar. Kana pong limpyo nga vinegar, dili nang tapos-tapos sa tindahan. Dapat nakabalo if contaminated ba na or dili. Okay. And then treat partner as well to prevent the infection. Pag mag-metronidazole, no alcohol ha. No taking in of alcohol or alcoholic beverages because it has an anti-abuse effect. Walang nag-anti-abuse ang patient. And then you have moniliasis or candidiasis. This is caused by Candida albicans, no? Which are fungi. Ang problema pag ang mama na ay moniliasis or candidiasis, agi sa bata niya during vaginal delivery, it can cause oral thrush in the fetus. Oral thrush. So signs and symptoms of moniliasis, you have the white cheese-like patches that adhere to the walls of the vagina. Ay murag mga milk curds, mananggahi nga gatas diya sa walls of vagina. So management ani antifungals like mycostatin, cotrimazole, canesten, gentian violet. Ang kaning gonorrhea, this is caused by a bacterium na Neisseria gonorrhoeae. Mag-produce siya thick, purulent discharge. So, ang mga treatment, ani antibiotics. And treat also the sexual partner. Then, kung di-treat ang sexual partner, inibalik na po nilang pointus, balik na po ng infection. Isang naayon na siya. And then, vaginal warts. This is due to Condyle acuminata. This is also called, by the way, as Condyle acuminata, which is caused by the HPV. HPV na virus. So, ang management ani, cauterization. Or di pwede na mag-vaginal delivery while active din ang mga infection because it can cause that it can be transmitted to the newborn. Okay, and then we have abdominal changes also. So, say may tabo sa abdomen, first anong nasa picture, no, nga murag na ay mga pinarwasan ang iyahang abdomen. That is what we call as the striae gravidarum or pregnancy stretch marks. That is due to the destruction of the subcutaneous tissue because of the enlarged uterus. And then for the skin changes, we have the melasma or cloasma or the mask of pregnancy. Just like what you see in the middle ng picture. Mura siya na ay mask na lago. So that is melasma or cloasma or mask of pregnancy. Okay? That is a white, light brown pigmentation related to melanocytes, which is usually on the face, no? Most people get it on their cheeks, on the bridge of their nose, on the forehead, on the chin, and above their upper lip. It also can appear on other parts of the body that gets lots of sun, such as the forearms. And then kanang nasa third picture, that is the linea nigra. Okay. Sumurag na ay partition ng abdomen in between, no? That's the linea nigra. But eventually it will disappear after delivery, no? Pwede ko siya ma-disappear completely. Meron siyang silver marks after delivery. And then for the breast changes, we have, because of the hormonal changes, the patient or the pregnant mother will experience feelings of fullness, tingling, and tenderness in the breast that is due to increased stimulation of breast tissue by the high estrogen level. There will also be change in color and size of nipple and areola, so it will become darker and bigger. And by the 10th week, by the 16th week rather, there will now be the appearance of colostrum. Colostrum is the first breast milk, no, that is produced by the breast of the pregnant mother. So by the 16th week of pregnancy, colostrum can be expelled from the nipples. Sa ovaries naman sa mother or sa woman, mo na vacation leave sa atong ovaries pag mapuros na.
ovulation. Rest period niya for 9 months. Okay? So, let us now go to the presumptive, probable, and positive signs of pregnancy, which can be found on page 210 to 212 of your books. So, katong pareha sa na akong edition, 8th edition. Okay. So, for the first trimester, ang presumptive sign. Ang presumptive sign, pauna siya ang, saingan ini, kanang, presumptive signs are signs and symptoms felt and observed by the mother but does not confirm the diagnosis of pregnancy. Ano siya ang mga signs of pregnancy na ma-feel sa mother, ma-observe sa mother, pero dili gyud ka ka-confirm ba nga pregnancy na. May mga conditions sa imong lawas na pwede siya mong mimic ana nga mga signs. Ang probable signs of pregnancy, these are the signs which are observed by the members of the healthcare team or the examiner. Na dili gihapon confirmation of pregnancy kay 1 month na nang unsay tawag ini na may uban mga sitwasyon lagi nga pwede mong mimic ani nga mga unsay nga mga signs and symptoms. And pero pag positive sign na gali, mo na siya assured yun nga signs of pregnancy. These are undeniable signs confirmed by the use of instruments. Okay, so let's look at the presumptive, probable, and positive signs of pregnancy. For the first trimester, ang presumptive sign would be breast changes, urinary changes, katag itong mag-urinary frequency si mama, fatigue, amenorrhea, morning sickness, enlarged uterus. And then for the probable sign, you have the Goodell sign. Ano sa itong Goodell sign? That was the
softening of cervix, ma'am.
Yes, softening of the cervix. Tapos yung Hegar sign. Ano sa itong Hegar sign? Sa uterus po niya siya, no? Softening of the uterus. And then there will be elevated basal body temperature and a positive HCG or a positive human chorionic gonadotropin test sa iyang urine. Ma'am, ingon niya mo sa ako, ma'am, di ba ma'am nga, ma'am, nga nung ma'am presumptive o probable naman siya? Nga nung breast changes, di ba ingon ka ma'am mga pregnant ang mama, ma'am, modako ang breast, full, modako, madark ang areola o ang nipple. So, puros naging siya, ma'am. Yes, it is a sign of pregnancy, but it may also be a sign of other conditions. Such as, for example, hormonal irregularities can also cause breast changes. Ma'am, urinary changes, ma'am. Yung diya ka ganina, ma'am, ha? Nga mag-urinary frequency gid ang pregnant mother during first trimester niya. Nag-urinary frequency naman siya, ma'am. Nga nung ma'am, presumptive pa man. Nga nung dili pa man na siya confirmed yun yung pregnancy. Una, kayo di ay nag-urinary frequency, kung bayan ka. Diba? And so on. Fatigue, ma'am. Ang mapatig mo din na kung na kay anemia. Amenorrhea, ma'am. O base hindi naglayag lang. Morning sickness, ma'am. O base nang di ay gikuan lang ta. Di kabuhi lang. Diba? Enlarged uterus, ma'am. O base schistosomiasis lang na. Or, natay gitawag o molar pregnancy. H-mole. High dectiniform mole. Nga mo na ako ginampiyan. Mataas gid ang HCG level pero over na kay pagtaas ang HCG level. Choriocarcinoma di ay. Cancer of the chorion. Dili gina siya tinuod ng pregnancy. Pero modako, may enlarged din po ng mga uterus, mataas din po ng HCG levels, but that is not considered as pregnancy. Chadwick sign, ma'am. Walang ko na ang vagina during pregnancy, ma'am. O basta din naipit lang, ano yung lago. Diba? So, signs, yes, signs na siya sa pregnancy. Pero dili yun yung mga confirmation. Pwede man nga na ay laing hinungdan. Okay, probable. Kung mamingon ka mama, kung mo-soften ng service, kung uterus na inanong kung nakay Goodell sign o Hegar sign, puros na. Lagi, signs lagi na siya of pregnancy. Pero na may ibang conditions like infection that may cause softening of the cervix and the uterus. Ma'am, elevated PTT, ma'am, inungyak ka ma'am, nakuan. Sign po ba na siya sa kuan, di ba? Sign po na siya nga nagkuan ka, ovulate, elevated PTT, hindi ng pregnancy, ovulation. Positive HCG, kanigit ma'am, positive naman din ang urine test niya ma'am, duha naman yung niya ma'am, may ingat kagyapo kang sure, Hindi po kag probable pa ma, dili positive. Na positive na din nakabutang ana o. Just like what I said to you a while ago, if it is a mole or pregnancy or if it is a high dative for mole or choriocarcinoma, cancer of the chorion, taas na dyan po siya HCG mo. Positive dyan po na yung pregnancy test. Naman siya HCG. Pero dili na siya pregnancy. So, probable siya. Yes, sign siya sa pregnancy pero di pa din siya confirmative. What is positive or confirmative or undeniable is the evidence in the ultrasound. Pag nagpa-ultrasound si mama, yan lagi nakita dito nga lagi nagtubo nga bata. Yan lagi heartbeat dito nga nagbitbit. Kana, makaingon nag-sure na din nga nagsabak si mother. So, nakita ang presumptive probable positive test. Pero signs di na siya tanan sa pregnancy. Okay. Sa second trimester, also may mga presumptive, probable or positive signs. We have, for the presumptive signs, you have cloasma, linea nigra, increased skin pigmentation, stray gravidarum, quickening. Tana, signs of pregnancy na siya tanan, pero pwede po na ilaing conditions na makakos ana. Kung nagita makaingon nga sure na yun, presumptive, sa nag-presume sa atak nga pregnant na ang mama. Okay. And then we have, for the probable sign, ballotment. What's an ballotment, by the way? Ballotment is the bouncing of the fetus. No? It is an obsolete method of diagnosing pregnancy with the tip of the forefinger in the vagina. Then a sharp tap is made against the lower segment of the uterus. And if the fetus is present, it is tossed upward. So, bounce ang uterus. Bounce ang uterus, bounce ang fetus. Ma'am, kana ma'am, wala na maginig-bounce na ng fetus. Anong probable pa man siya, ma'am? Mag-ipamag na siya sure. Because ballotment, aside from being a sign of pregnancy, could also be noted if a patient has myoma. Nagabay ballotment, may tabo po na myoma ang patient. Mga di ba kita siya sure signs, probable sign lang. Braxton Hicks contraction. Nag-contract ang uterus. Mga nagibata man yung contract naman ang mga anak ko nagay naman. But there are other conditions that can cause contraction of uterus. Di ba? So, ang pinaka-positive gini mga sign during second trimester, denial, kung hindi kalalis na na ibang kasulod, would be the fetal heart tone, the fetal movement, the fetal outlook, and palpable fetal parts. Sure, nagkita nga ay titong sulod sa iya, uterus. Okay. So, in grading the placenta, by the way, grade 0 means immature, grade 1, slightly mature, grade 2, moderately mature, grade 3, fully mature. Okay, so it is not only the physical body of the pregnant client, which will change during pregnancy, but we also have the psychologic adaptation to pregnancy. This is found in page 203 to 209 of your book. This a psychologic adaptation to pregnancy. So naapoy may tabo nga changes sa iyang psyche, sa iyang mind, no? Sa iyang emotions. So during the first trimester, there will be feelings of surprise. Ma-shock pa siya nga, uy, pregnant na po. And then there will be ambivalence. Na-please siya, nalipay kayo siya, at the same time, hindi ko siya ma-please na pregnancy. Okay? Mataas ang anxiety level. So, nalipay, nawak malipay na napurush. And then some mothers would have denial of pregnancy. That is not normal, ha? Kanang na denial of pregnancy, that is a maladaptive patterns of behavior na siya. Na may problema sa iyahang mind. The ambivalence, normal. Feeling of surprise, normal. What is not normal? Denial of pregnancy. Anyway, the developmental task here is to allow the woman to accept the pregnancy. Okay? We let the woman, we teach the woman, we explain to her that so that she will accept the biological facts or reality of pregnancy. Kung importante kayo na naatay enough knowledge and skills and attitude para mag-healthy change tas mga pregnant mother. Because ang task dapat niya is to accept the pregnancy. even the changes that will occur in pregnancy, no? Ang biological facts or reality ng pregnancy ato nang i-teach sa iya. So our health teachings will focus on body changes during pregnancy and nutrition. So katong body changes nga itong isbutan na din na katong floasma, linya nigra, frequency of urination, mga buan, dato Chadwick sign, Woodle sign, ato to siyang i-teach tanan sa iya. And nutrition, katong high iron, high folic acid, no? Kung kulang ang folic acid ng pregnant woman, it will lead to spina bifida. Mga na siya itong itudlo. Now, during the second trimester, the mother now identifies fetus as separate entity due to quickening ka na ng manita na siya, no? Movement, mag-move na fetus. So, makibalo na ang mother nga, uy, there is a separate person inside my abdomen. So, the mother identifies fetus as separate entity due to quickening. Narcissism and introversion would occur in pregnant mother as they concentrate on what it will feel like to be a parent. So medyo iyang kaugalingon yung ginaon na preoccupied siya bubunaw na saan nakaano pag mother na yun. So narcissism and introversion is common. Okay, the mother may find here experiencing fantasy, daydreaming, and role-playing about being a mother. No? So at the developmental task of the mother here is accepting the baby, accepting the growing fetus as a baby to nurture. And our health teachings as nurses to the patient will focus on the growth and development of the fetus. Katapos the lecture last time. Now what will happen on the first trimester? On the how many 20th weeks of pregnancy on the naitabo. Ato itong i-teach sa ato ang pregnant na mga clients. Then on the third trimester, the mother has personally identified with the appearance of the baby. So our the developmental task of the mother here is preparing for parenthood. Prepare dapat siya for childbirth and parenting the child. So our health teachings here is focused on responsible parenthood, preparing the baby's layette, and having the woman enroll in a Lamaze class. We are also going to address the mother's fear by letting her hear the fetal heart tone. Okay. Now, during pregnancy, any questions so far on the changes? During pregnancy. So during pregnancy, it is important that we encourage the woman to go on a prenatal visit because prenatal visit is really very important. Importante din na mag-prenatal visit ang mama para mahibawan kung naabay mga abnormalities na dapat i-correct, no? Para mahatagan siya advice on how to maintain a healthy pregnancy and so on. Kung ano importante na mag-prenatal visit kayo ang pregnant mother. So, kapila man siya dapat mag-prenatal visit. Okay, dapat 0 to 28 weeks of gestation every 4 weeks. 29 to 35 weeks of gestation every 2 to 3 weeks. And on the 36th to 40th week of gestation, every week. Pero ang DOH, ang recommendation lang sa DOH is very minimal lang. Dapat ay mo sundon ka na nasa ibabaw na frequency of visit. Pero kung ang Pinoy lagi, as kang takula na mo visit of doktor, yung mahadlok bilay-bayran na, no? So, very minimal lang ang recommendation sa DOH. Okay. First visit as early in pregnancy as possible before 4 months during pregnancy. So, pag first trimester, first visit, one visit lang, pwede na sa DOH. Parehas kaning sakto yun nga every month dapat sa first trimester, every month kang mag-home visit, mag-prenatal visit. Pero sa recommendation sa DOH, first visit as early in pregnancy as possible before 4 months or during the first trimester. And then ang second visit during the second trimester na po. Third visit during the third trimester. And then every 2 weeks na dahil after 8 months of pregnancy until delivery. Wala ning pinaka-minimal na recommendation sa DOH. Pero mas maayo kung inaani ka ka-consistent. Ingon ani ka permit. 0 to 28 weeks every 4 weeks, 29 to 35 weeks every 2 to 3 weeks, 36 to 40 weeks every week. Pero kung tapulan ka matupok mo, at least follow na lang ni DOH recommendation. Okay, so what are we going to do when the patient goes on a home visit, whether it is in the community health clinic or health center, or whether it is in the clinic of the private doctor in the hospital. By the way, prenatal visit is found on page 227 to 254 of your book. Okay, so first, we are going to obtain the personal data of the patient, no? So in the health center, we call that as a home-based mother's record or the HBMR. Sa kaning home-based mother's records, ma-determine dali we should determine high-risk pregnancy. We should include the complete menstrual history of our patient. We should include also the previous obstetric history. Even the past medical history should also be included. Okay. By the way, na condition na gitawag og pseudocyesis, no, or false pregnancy, wherein mo-appear ang presumptive of probable signs pero dili na siya pregnant. That is because of hormonal changes. Kung itong presumptive of probable na siya, pwede ka po siya ma-occur sa tika-puros na alay hormonal changes or other condition. Pero mula tika-puros, the signs and symptoms of pregnancy man di mo ka-feel. So that is what you call a pseudocyesis or false pregnancy. Namoy uban bana, no, nga mo develop of psychosomatic disorder wherein they will experience what the mother goes through. You call that as the Covad syndrome or Covade syndrome, however you pronounce that. Covad syndrome or Covade syndrome. Ang papa, ang bana, mao'y maka-experience or ma-experience po sa bana o sa papa ang i-went through sa mother during pregnancy. So kung nag-morning sickness si mama, nag-morning sickness po sa papa. That is Covad syndrome. Okay? You have to include that also in the home-based mother's record if ever it is present. And then you have the diagnosis of pregnancy. Usually it is through a urine exam, no? Kung positive ng urine exam because of the presence of HCG or human chorionic gonadotropin. Musaka na ang HCG level nato by the 40th to 100th day of pregnancy. Mo-reach na siya sa iyang peak pag-abot of 60 to 70 days of pregnancy. And then, during prenatal visit, we also have to obtain the baseline data of our patient. So we do weight monitoring. And then, ang pregnant mother na siya normal weight gain. Wala yung pregnant mother na ni ubo ang timbang. Mutaas din ang timbang. No? So, usap siya kaniwang before pregnancy, mutaas din na ang iyang timbang. Okay. So, unsa may normal weight gain during pregnancy? Sa first trimester, there would be around 1.5 to 3 pounds of weight gain or 1 pound per month. During the second and third trimester, 10 to 12 pounds or 1 pound per week or 4 pounds per month. And then, the minimal allowable weight gain is 20 to 25 pounds, whereas the optimal weight gain is 25 to 35 pounds. So again, during the first trimester, 1.5 to 3 pounds ang iyahang mag-gain, or that is 1 pound per month. During the second trimester, 10 to 12 pounds iyang mag-gain, or that is 1 pound per week, or 4 pounds per month. Ang minimum allowable weight gain throughout the pregnancy is 20 to 25 pounds. Ang optimal weight gain, 25 to 30 pounds. Asa makita ni weight gain? No, ano weight gain man siya. Okay, that is because mudako man ang iyang breast. So the gain of weight from the breast is 1.5 to 3 pounds. From the fetus, that is 7 to 8 pounds. According to Pilitary, 7.5 pounds. The placenta, 1 to 2 pounds. According to Pilitary, 1.5 pounds. Amniotic fluid, 2 pounds. Uterus, 2.5 pounds. Body fluids, 4 pounds. Body fat, or that is from maternal fat at the stores, 7 pounds. Blood volume or maternal blood, 4 pounds. Okay. During the prenatal visit also, we obtain the obstetrical data. Okay? So, also may obstetrical data nga itong makuha. By the way, ang atong kwaon nga data, gravida para, okay, abortion, usually GPA ragid na siya ang una, no? Pero gravida is pregnancy, para is delivery, gravida, number of pregnancy, para number of delivery, a number of abortion. Okay? Pero recently, we use the GTPAL system. GTPAL is a 5-letter system used to more completely describe the woman's obstetric history. So, obstetrical data or obstetric history, mo gamit ang GTPAL system. Okay, wherein G represents the number of pregnancy regardless of the result, including the present pregnancy. Kapila na siya ng burus, including karon nga pagkaburus niya. Ang P, that is the number of full-term infant. Pila ka buong iyang na anak na full-term. Full-term meaning abot og 37 weeks bago siya na anak. Ang P, number of preterm infants or number sa iyahang pila ka buong iyang na anak between 20 to 37 weeks preterm. Ang A is the number of spontaneous abortion or miscarriage. Ito is different siya sa preterm o abortion. Ang preterm na tao 20 to 37 weeks. Ang abortion ni gawas before 20 weeks. Okay, L is the number of living children currently alive. And hapay ba na imong GTPAL na by M, no? M is for multiple pregnancy. Okay. So, ang age of viability, meaning, kanang unsay age sa fetus na pwede na siya mabuhi kung mugawas siya, 23 weeks. Hindi sure na mabuhi, pero pwede na siya mabuhi kung mugawas siya at 23 weeks. Pero ang dapat yun nga term or full term na infant, kanang mugawas siya, hingkod na gid mabuhi na gid sa kalibutan bisag walay mga additional na scientific intervention, the term infant should be 37 to 42 weeks. Preterm na siya kung 20 to 37 weeks siya ning gawas. Abortion na siya kung less than 20 weeks siya ning gawas. Okay. So, example ha, atong pangitaon ang GTPAL ani na client. A client who is pregnant man yun, no? Hindi na may who is pregnant man yun ang client na mag-prenatal visit. Alangan mag-prenatal na rin pregnant. Okay. A client comes in for prenatal checkup and tells to you that she has had one abortion in the past pregnancy. So what is the GTPAL of this woman? Bilay Genia.
Number of
Again ha, ang woman ni ana siya during her history taking, ningon siya nga sa una na aborto ang iyahang previous pregnancy. Guys, naburos na siya sa una pero na-abort lang. So, pilay GT-PAL. Unsa may iyang GT-PAL? Miss Alfaro, pila iyang G?
1.
Napa mo din na?
Yes, ma'am.
Ay, habonero na lang. Pila iyang G? G is number of pregnancy. Ang iyang G, 2. Ikon man nato G2. 2. Nga naman, naburos man siya sa una pero na-abort niya. Buros man siya karon po. So, G2. Pila yung P? 0. Wala siya full-term infant nga naanak. Kaya na-abort man itong Pilmiro. Pila yung P? 0 gihapon. Pila yung A? 1. Pila yung L?
0.
Kaya aborted man itong Pilmiro. Okay, let's see. Okay. Another problem. A 26-year-old female is currently 26 pregnant. Paminaw ha? A 26-year-old female is currently 26 weeks pregnant. She had a miscarriage at 10 weeks gestation 5 years ago. She has a 3-year-old who was born at 39 weeks. What is her GT-PAL?
Ito na daw, ma'am.
Again, a 26-year-old female is currently 26 weeks pregnant. She had a miscarriage at 10 weeks gestation 5 years ago. She has a 3-year-old who was born at 39 weeks. What is her GT-PAL? Pila yang G? Is Acapulco.
One, ma'am.
Ganong 1 man.
Kaya naman siya'y anak, ma'am.
G is the number of pregnancy.
Ay,
Kapila siya na puros.
3 times.
Pila?
3.
3. Sakto. Sakto 3. Ready ba? Puro siya karon, 26 weeks. Nag-miscarriage siya 5 years ago. Ikaduha na itong pagkaburos. Na siya'y 3-year-old karon na naborn at 39 weeks. So, isa na po niya na pagkaburos sa una. So, katulo na siya kanaburos. G3 na. What about T, Miss Bangga?
Term.
Pila iyang T?
Duha.
2, ma'am.
Ha? 2?
2.
1 lang. Diba? Kaya ka na yung current pregnancy. T is number of full-term infant, meaning born 37 weeks or after. Puro siya karon, pero pa man niya mga anak, kung matakabalo. Katong 5 years ago, aborted man, ay miscarriage man or abortion. So, why dili full term? Pero katong 3-year-old niya karon, born at 39 weeks man daw, is 39 weeks full term. Yes. So, 1 lang iyang T. T1 lang. What about P? Pila yung P, Miss Bayhon?
Pina kay Peter Boy.
1, ma'am.
1? Wala. Naa siya'y preterm infant nga naanak? Wala. 0 iyang P. Remember, iyang naanak sa una, duha. No? Isa ka abortion or miscarriage, isa ka full term na 3 years old na karon. Na ay preterm, wala. 0. What about her A? Mr. Baron?
1, ma'am.
Yes, 1. Naa siya abortion 5 years ago. Okay. What about her L, Miss Loares? 1. Naa siya living child na isa, tatlong 3-year-old, so L1. Therefore, a 26-year-old female who is currently 26 weeks pregnant, who had a miscarriage at 10 weeks gestation 5 years ago, and has a 3-year-old who was born at 39 weeks, has a GT-PAL of G3, T1, T0, A1, L1. Okay, another problem, last problem. A 35-year-old female is currently pregnant with twins. She has 10-year-old triplets who were born at 32 weeks gestation. and 16 years old who was born at 41 weeks gestation. 12 years ago, she had a miscarriage at 8 weeks gestation. What is her GTPAL? Again, a 35-year-old female is currently pregnant with twins. She has a 10-year-old triplets who were born at 32 weeks gestation, and 16 years old who was born at 41 weeks gestation. 12 years ago, she had a miscarriage at 8 weeks gestation. What is her GTPAL? What is her G? Mr. Nakila,
Regardless.
what is her G?
1, 2, 3, 4, 5.
Wala si Mr. Nakila. I-remove natin. Miss Pakamalan, what is her G?
7, ma'am.
7. Ihap din mo isa-isa ang iyahang triplets o iyahang twins, no? Pero ang pregnancy, bisan pag multiple, we will count it as 1. So, G4 ra gihapon and G. Ha? Upat ra gihapon siya na boros. Kanang iyang giboros karon, kadtong iyahang giboros nga twin sa una, so ikaduha na to. Kadtong iyahang diday. Kanang iyang twins karon, isa na siya kaburusan. Kadtong iyang triplets sa una, isa kaburusan. Kadtong iyang 16 years old karon, isa kaburusan. O kadtong iyang miscarriage 12 years ago, isa kaburusan. So 4 tanan. Okay? What about her T? Mr. Basamik?
Isa. Tingnan ko pa isa. Ang
5, ma'am.
5 na full term? Okay, I will repeat ha. A 35-year-old female is currently pregnant with twins. Of course, wala pa na siya mag-preterm or one, sigurus pa man, di ba? She has a 10-year-old triplets. She has 10-year-old triplets who were born 32 weeks. Definitely, 32 weeks is not term. It's preterm. Now she's 16 years old who was born at 41 weeks. Term ba ang 41 weeks? Yes, above 37 weeks naman siya. So na siya 1 term. 12 years ago, she has a miscarriage at 8 weeks gestation. Of course, dito term. So, ang iyang term, ang iyang P, 1 lang. What about her P? Joey, Asadera.
1, ma'am.
Ang iyahang preterm, 1. Kadto si ang mga triplets nga who were born 32 weeks. What about her L? Number of living children. Miss. Ha?
About sa kay A, ma'am.
Oh, A pa di ay. A. Bilang A.
1, ma'am. 1, ma'am.
1. Isang abortion, no? Katong 8 weeks gestation 12 years ago. Okay. What about her L? Miss Mandam. How many living children does she have?
8, ma'am.
Ano na 8 man itaw mo eh? Makita ng 8 ka buo. Nga, triplets, so tolo. Kunya, katong 16 years old, isa.
4.
Ya, patay mo itong miscarriage. 4 lang. 4 lang yung living children, ha? L4. So, kana, pag living children na, ihapon na ginagawa isa-isa itong triplets. We will not count them as 1 anymore. So, again, ha? A 35-year-old female is currently pregnant with twins. She has 10-year-old triplets who were born at 32 weeks gestation, 16 years old who was born at 41 weeks gestation, and 12 years ago she had a miscarriage at 8 weeks gestation. What is her GPAL? G4, E1, E1, A1, L4. Okay, very good. Nasabot mo GPAL. Okay, so these are the most common terms, no, that you may encounter sa about obstetrics. So we have primigravida. Gravida is pregnancy, no? Para is delivery. So when you say primigravida, that is a woman who is pregnant for the first time. Ano yung ito? Primis. Pregnant for the first time ang primigravida. Primipara, a woman who has given birth to one child past the age of viability. primipara. Multigravida, a woman who has been pregnant previously, meaning kadaghan na siya, kaduha or kadaghan na siya ng puros, multigravida na siya. Kung kaduha or kadaghan na po siya nanganak, multipara na siya. Kung wala pa gid siya ma-pregnant ever since, nulligravida na siya. Wa pa gid siya manganak ever since, nullipara ang tawagan. So, primigravida, first time na boros. Primipara, first time manganak. Multigravida, kaduha kadaghanan na boros. Multipara, kaduha kadaghanan na nanak. Nulligravida, wala pa maborosukad. Nullipara, wala pa manganak sukad. During a prenatal visit also, we should know the different estimates, no? Okay, the most important estimates that we have to do in order to determine, no, the age of gestation. Kung saan nakadugay na iyang pagkaburos sa babae. Okay, so first, manaman mo ani sa inyong NCM 101. Sa pagpaso na lang nato. We have Nagel's Rule, page 187 to 188 is yung libro. Nagel's Rule, this is used to determine expected date of delivery or confinement, no? So if the last menstrual period of the mother is from January to March, so we are just going to add 9 months plus 7 days. And then same year na siya mga anak. If the last menstrual period is from April to December, so the formula is minus 3 months plus 7 days plus 1 year. So you refer back to your learning in NCM 101 last year. Okay, next is the McDonald's Rule. The McDonald's Rule uses the fundal height, no, in determining the duration of pregnancy. This is found in page 191. So it measures the size of the uterus used to assess fetal growth and development during pregnancy. It is measured from the top of the mother's uterus to the top of the mother's symphysis pubis. Fundal height, when expressed in centimeters, roughly corresponds to gestational age in weeks between 16 and 36 weeks for a vertex fetus, on a vertex presentation. So, by measuring the fundal height in centimeters, kung pila imo makuha, ay kung pila ang centimeters, pila ka centimeters na yung fundal height, multiply it by 2, divide by 7, then you'll get duration of pregnancy in lunar months. Fundal height in centimeters multiplied by 8, divided by 7, then that is the duration of pregnancy in weeks. Okay, then we have the Bartholomew's Rule of Fourths. This calculates the estimated age of gestation of a fetus depending on the height of the fundus and is an approximation only. No? So, it does not and cannot accurately predict gestational age, but gives a close enough rough estimate. Okay? So, pag 12-week gestation, the fundus is in the symphysis pubis. Makaingon ka nga, using Bartholomew's Rule of Fourths, makaingon ka nga, uy, ang fundus na symphysis pubis, so around 12 weeks na iyang pregnancy. Uy, the fundus is midway between the symphysis pubis and the umbilicus, so this is 16 weeks of pregnancy. Uy, the level is now at the umbilicus, so this means 20th week na ni sa iyang pregnancy. Uy, ang fundus nasa xiphoid process, nanan is 36 weeks of pregnancy. That is just an estimation, ha? Okay. Ang height sa fundus sa 32 weeks o 40 weeks, the same ra sila. Kay although pag 40 weeks, dako unta na iyang fundus, no? Pero ning-us man siya because of lightening. Mo na nga same level na ang 32 and 40 weeks. And then we have the Hass's Rule, okay, which determines age in months. Okay, so what you're going to do, the formula of Hass's Rule is, for the first 5 months of pregnancy, we are going to square root, no, the length of the fetus in centimeters. So square root of the length in centimeters equals approximate age of the fetus in months. From 5 months and onwards, so the length in centimeters is divided by 5 and you will get the age in months. Vice versa, you could also estimate months na po yung given data. So from 1 to 5 lunar months of pregnancy, you are just going to square the month of pregnancy and then you'll get the fetal length. For example, pagka 5 lunar months, square na nimo 5 times 5, 25 centimeters. Ay, 25. Alagi, 25 centimeters pasabot ang length sa fetus pag abot sa 5 lunar months. Okay? 3 lunar months, 3 times 3. So, 9 centimeters ang fetus anak. Okay, pero pag abot ng 6 to 10 lunar months, lahi na po ang formula, di na square. Multiply the month by 5 na. So, pag abot ng 6 months, times 5, so 30 centimeters ang fetus. Pag abot ng 8 lunar months, times 5, 40 centimeters ang fetus. So, that is the Hassey's rule. Of course, that is not accurate. That is just an estimate, no? Hindi na hindi ang length ang fetus ko. Depende sa iyang kaliwan. No? Ay upo, taas, ay igo ra. Okay. So, a pregnancy, a full-term pregnancy would last 9 calendar months or 10 lunar months. Anong 10 months pag lunar months? Ang calendar months sabi 30, 31. 29, 30, 31 ang ubang months, no? Pero pag may yung tag 10 lunar months, ang 1 lunar month, anak, 28 days lang. Okay? Manan siya ang pregnancy. May mukha ko ba may mag 10 months? Kung ba may 10 months of pregnancy? 9 calendar months, pero 10 lunar months. Okay. Now, an important thing also which you should remind your mother or your pregnant mother during a prenatal visit is a tetanus immunization, because the woman and her child is prone to developing tetanus, especially during delivery, na naipangkat na cord, no, na ay mga pater nga mga kuan, nga mga terminium, okay? So, pwede ba ng bata ma-injured? So, prone to tetanus kung di sterile or kung na Clostridium tetani ang mga materials na gigamit sa during delivery, during labor and delivery, or tungkol sa iyang samad, na-expose na din siya sa tetanus neonatorium kung naamang dali sa air or sa iyang environment, no? That is why we have to protect the mother. Ang kanang tetanus na ma-develop during the of the newborn, no, during delivery, that is what we call as tetanus neonatorium. Okay, anyway, so to prevent tetanus, we have to ensure that the mother really submits for is really immunized against tetanus. So, lima ka doses na tetanus immunization na ihatag sa pregnant mother. Kung pa siya immunization sukad. TT1, that is given anytime or early during pregnancy. TT2 is given 1 month after TT1, and it will give you 3 years protection. TT3 is given 6 months after TT2, and it will give you 5 years of protection. TT4 is given 1 year after TT3, and it will give you 10 years of protection. And then TT5 is given 1 year after TT4, and it will give you lifetime protection. Okay. Ang DOH recommendation, ani, 2 doses daw of tetanus toxoid vaccination must be received by a woman 1 month before delivery to protect the baby from neonatal tetanus or tetanus neonatorum. And the 3 booster dose shots is to complete the 5 doses following the recommended schedule provides full protection for both the mother and child. The mother is then called as a fully immunized mother after receiving the 5th dose of the tetanus toxoid vaccination. Okay. So, one thing also that we're going to do during prenatal visit is doing a physical examination, and we should know what are the danger signs of pregnancy. Kanina, na-discuss naman ang mga normal occurrence, no? Normal changes in the body of the mother during pregnancy. Pero we have to be watchful of the dangerous signs of pregnancy, na kung makita nato siya, we have to refer the patient to the doctor or her obstetrician and gynecologist. So we have chills and fever, cerebral disturbances, abdominal pain, or epigastric pain, which is an aura of an impending convulsion. sabi na ng mga mother na ay pregnancy-induced hypertension. Okay, pwede na siya magka-convulsion. So, ang aura na, bago mag-convulsion, abdominal pain or epigastric pain. And then you have board-like abdomen, which is a sign of a brushal placenta. Blurred vision, which is a sign of preeclampsia also. And then bleeding. It may be a sign of abortion or ectopic pregnancy if it occurs in the first trimester. If the bleeding occurs in the second trimester, it could be because of hydatidiform mole or incompetent cervix. If it occurs in the third trimester, it may be a sign of placental anomalies, like placentaphobia or a brushal placenta. And then increase in blood pressure, swelling, spotoma. Spotoma is a blind spot, no? And that is a permanent or temporary area of depressed or absent vision caused by lesions of the visual system. And then sudden gush of blood, which is a sign of premature rupture of membranes. And then we have the pelvic examination. Found siya page 242 to 249 of your book. Okay, the pelvic examination or IE. Okay, dapat ipa-empty na to ang bladder sa mama before an IE. So, for an IE to occur, for an IE, what are we going to check or assess? Listen. Okay, so during the IE, mo ni imuhang kung ano i-assess. For the first visit, so check for the, you could check now for the Chadwick's and the Goodall signs and the other signs. Position during a pelvic examination would be dorsal recumbent or lithotomy position. Pap smear is also usually done in the first visit. So this cytologic exam to determine the presence of cancer cells is done. So ang result ani kung class 1 normal, kung class 2A cytology without evidence of malignancy, class 2B suggestive of inflammation, class 3 cytology suggestive of malignancy, and then class 4 cytology suggestive of malignancy, class 5 conclusive for malignancy. Most common cancer report organ is cervical cancer. Most common site for pap smear, external os of the cervix. So the most common site for pap smear, external os of the cervix. Most common site of cervical cancer is also found in that area. That's why that is where you are going to check for pap smear. Okay, we have stages of cervical cancer. Stage 0, another cytologic exam resulting in a pap smear. Class 1 normal, class 2A cytology with evidence of malignancy, so on. We have already said that. And then for the stages of cervical cancer, 0, that is carcinoma in situ. 1, CA or cancer strictly confined to the cervix. 2, from cervix extends to the vagina. 3, pelvic metastasis. 4, affectation to bladder and rectum. The next thing that we are going to do during